Good day and welcome to another special featured interview with 284 News. I am Jacka Wooding. Today we are discussing World Diabetes Day, the prevalence of diabetes in the Virgin Islands, and what can be done at the policy level and personal level to address the issue. We also learned that the BVI Diabetes Association is busy this month, so we will be checking in on everything going on with them as well. Joining me in studio to speak on these very important topics is President of the BVI Diabetes Association, Dr. Sharlon Lewis. We will be getting into things right after a quick word from our sponsors.
Freeze. Choose your mix. Choose your flavor.
Welcome back. As I mentioned before the break, today I am joined by Dr. Sharlon Lewis, President of the BVI Diabetes Association. Dr. Lewis, thank you so much for your time.
Thank you for having me, Jacka. It is a pleasure to be back here with Tweet. Always happy to help.
Of course, and I see that you're wearing your blue. I took some notes as well, so we are certainly dressed for the occasion.
Wonderful. Thank you for participating.
Of course, November has been a busy month for the BVI Diabetes Association, diabetes associations across the world, and we would have seen World Diabetes Day being observed on November 14th. So I think that's a good starting point for us. Take us into things. What is World Diabetes Day and what's the relevance of this observation in the BVI?
So World Diabetes Day, which is the 14th of November, this was, Monday gone. It's the day set aside by the International Diabetes Federation for everybody to kind of come together and just be more aware of this chronic disease in our, communities. The theme for 2021 to 2023, which is actually a 3-year span, is going to be access to diabetes care for all. This year in particular, 2022, it is education to protect tomorrow. So that was really, our time to kind of make that observation. What we did on that day is that we actually had a human circle. So we asked persons to dress in their diabetes shirt, like I'm wearing mine now, or any awareness shirt, or even just blue. And they came out to the Cyril B. Romney Tortola Pear Park, and we actually did a circle. We did a photo with everybody in the shape of a circle, and that's something that we're going to send to the International Diabetes Federation to actually be posted, along with all the other observation pictures. Granted that our circle is a little small in the picture, and obviously, in bigger countries, they have circles with 3 layers and whatever, but we do our part because we're really trying to raise awareness just even about the chronic disease here in our community.
I would have seen some statistics from the International Diabetes Federation that said about 9.4% of adults in the BVI are facing diabetes. So what is really the role of the Diabetes Association in, raising awareness here in the BVI and assisting the people who are facing diabetes?
Well, according to WHO, since 1980 actually, so in the space of, somebody's lifespan, there's actually been a doubling of diabetes rates around the world. I think the latest stat from IDF was it 7 million people living with diabetes around the world. To be honest with you, we do not have exact statistical numbers here in the BVI because we do have a lack of capturing that information. There's a lot of, we don't have coherence between a lot of the different medical entities, and so we don't have exact numbers at this time. It's definitely something that we need to work towards, in the future. And, we being the Diabetes Association, that's something that we're going to have to be pushing for. Why we raise awareness is because we know that even though we don't have the actual numbers, you can see the amount of people that are suffering from diabetes. I come from a background, I've been here for many years, and I worked for almost 10 years in the public health system, and that included working in the hospital, working in different clinics, and you would see so many people coming in with, diabetes, high blood sugars, and they don't even understand what it means, much less to really be able to take better care of themselves. So from the Diabetes Association point of view, we go out into the community throughout the year various health fairs, or we might just decide to do a screening event, and we would go into the community. We would actually check persons' blood sugars and their blood pressure, because we know that they go hand in hand, and give advice when we do find that persons have high blood sugar readings. Give a little advice as to what they can do, or even try to encourage them to go to see their doctor so that they can actually get treatment for diabetes. Like I said, the theme for this year now is education to protect the future, to protect tomorrow. Yeah. And what we're doing this year in particular is we're actually having a symposium coming up, which I'm very excited about. One of the initiatives we had from earlier this year or last year, we started focusing a bit more on our type 1 diabetics. So statistically, you're talking about numbers. Whereas I think now it's every 1 in 11 people in the general population would be diabetic, you would find 1 out of 10 having type 1 diabetes. So they're smaller in number, we know that. Through a generous donation by a private donor, we were able to get what we call continuous glucose monitors. You ever heard of that?
I have not. Please fill me in.
So continuous glucose monitors are these little devices. It's about that big. And you put it on your arm. You can put it on your stomach. It sends a little needle, like a little fine needle, in through the skin, and it continuously checks your blood sugars.
Okay.
So rather than the person having to prick their finger all the time, which diabetics just love, hear the sarcasm. Especially for the children, that's going to be a real problem. So we got these devices that they put on their arm, and the family can either use their phone with the app, or they can use a sensor and just swipe it. So imagine in the middle of the night, rather than having to set up the machine and all these things, these families now are able to just swipe. And that's something that we're actually providing free of cost to our families.
Okay.
I'm so happy.
It's so exciting.
I am so excited. So in that vein, having dealt with these families, we realize that a lot of them are dealing with diabetes, but they haven't really been properly educated about how to manage at home. They know about checking the blood sugars, they might be put on insulin regimes, but in terms of living with the disease, and that's where we come in. There's a gap, we realize, between the care that a diabetic is given in the medical system and then having to live with it at home. So from our point of view at the Diabetes Association, we're hoping to be that bridge, to be able to fill that gap for the community.
I know recently CARFA would have emphasized the need to ensure that we have proper care for people living with diabetes. I think that was also in line with World Diabetes Day being observed this week. So
funny enough, through a coalition with the BVI Health Services Authority, Ministry of Health, and CARFA, we are this month actually having rollouts of new guidelines for managing diabetes in the community. We've had 2 sessions already so far, geared more towards medical professionals to introduce the guidelines. So even for us to be on the same page, and it might sound trivial, but for us to be on the same page to know, okay, what is the cutoff in terms of somebody's blood sugar to determine that they're diabetic, and then what would be the initial, treatments, and it would be lifestyle management first, and then
in that point,
and then looking into different medications, because most West Indian people do not like medication.
Absolutely. I mean, bush tea.
Exactly. And we wish that it were so simple that we could just drink a bush, the cinnamon tea, whatever, and it just magically goes away. Exactly. I'm not saying that these things don't help, but even, we can use those in conjunction with maybe some, more Western medications. But I keep telling my patients at the end of the day, these medications are only going to do so much. The medication is not going to fix a bad lifestyle. So they do emphasize first and foremost lifestyle management, and then going into the different medications and the way you do those combinations, and then even monitoring of your patients. So CARFA is really helping us in terms of getting those standards set. So no matter where you go, this is our BVI standard. That's been the first 2 sessions. On Tuesday, they're actually going to have, and it's via Zoom.
Okay.
So anybody can tune in. They're doing a community-geared session. So they're actually looking for persons who are living with diabetes, whether it's type 1, type 2, just to help sensitize persons on, managing at home. And like I said, we then have our whole day symposium geared towards our families and caretakers of persons who are living with insulin-dependent diabetes.
Now, this one might ruffle a few feathers.
Let me hear
You
it.
did speak about lifestyle. A common misconception that I've heard as it relates to diabetes, people just think they can cut out snacks and little candies, but
Right.
still go to the bar and consume as much alcohol as they would like. So let's just get it on record. What are the most common causes
Right.
of diabetes in the Caribbean?
It's honestly the sugars that we don't think about. So when you're in school, you learn about like your three major food groups. You're gonna learn about your proteins, you're gonna learn about your carbohydrates, and your fats. For a diabetic, your body is already having problems processing all, the sugar that it has to break down from your food. So the last thing you want to do is really to add a set of sugar onto that situation. And people don't take into account the things that we love, like our macaroni pie, our scalloped potatoes, the dumplings, even the ground provisions. They do all break down into sugar in your system. Granted that things like ground provisions and so do have more fiber, so it's a bit healthier. It's still a carbohydrate. And then we don't think about things like juice and, as you said, alcoholic drinks, which we love with rum, Caribbean people. But we don't take a lot of it into consideration. And I think, I know you said you haven't been in the BVI for all that long,
Yeah.
but we've been through a lot of very stressful situations here over maybe the past 5 years, starting with when we had Irma
Yeah.
in 2017, and then, the whole COVID pandemic and everything. And a lot of people do turn towards alcohol and even overeating to cope with, the stressors. And this has a detrimental effect on their health, one of which the consequence can be diabetes.
Now, when you think of diabetes, there's no real visual of signs someone would have. So since it's not something you wear on your sleeve, I can understand how that could play into having issues detecting the disease. But at home, in your personal life, what can you really look out for to know, okay, I need to go check in with my doctor?
One of the first things would probably thirst and excessive amounts of peeing, to be honest. That's a very common complaint that I would hear coming. And a lot of people think, oh, maybe I just have a little urine infection and that's why I'm, going to the bathroom all the time. But that's a very common complaint. The other thing is that, again, they might feel hungry all the time. They're eating, but they're always hungry. And they might be losing weight. You might gain a lot of weight. They might be a bit obese and overweight at first. And then all of a sudden they start losing weight, but they're eating either the same or even more. That's a sign that something might be wrong. Other things would be related to like the ill effects of high blood sugar. So things maybe with the eyes, maybe, strange nerve sensations, even maybe sometimes like problems with circulation and so in the body. Those are also issues. Poor healing. So you get a cut, somebody gets a cut on their leg and it's just not getting better. They're like, normally I heal well and why this thing not healing up? It could be because of issues to do with diabetes. I was in part of a presentation on Monday, however, and they were saying that persons who have type 2 diabetes, so the ones that you normally get with like older folks, those people, by the time they're detected, and especially if they have not been doing their regular checks, probably have had diabetes for at least 5 years. And so the effects that you would have like on your different systems, you have to make sure like you check for those things. And I'm like, that's crazy to think. You might already have some kind of kidney issue going on and, circulation issues. You're at risk for heart attacks and strokes. You're at risk for kidney failure. We have a lot of people here on dialysis, actually. And all the time we're just adding more. Between when I started at the hospital and when I left, there was honestly already like a doubling of numbers of people who are on dialysis. And it's frustrating and disheartening for me because these are things that people can avoid. They just a little bit more thought to the process.
Now that takes me into my next question because, in human nature, sometimes you have to help people to help themselves. Nobody wanted the lockdowns during COVID, but they did help, we have to admit. Now, from your expert opinion, what can be done from a policy standpoint to help people, live a healthier lifestyle and perhaps decrease the prevalence of diabetes in the BVI?
So, okay, where to start with this one? I think number one, what we're doing right now in terms of standardizing the care that people can expect when they go to the health professionals, I think is very, very important, because you can't be going to one doctor and this doctor telling you one thing, you go to, because people are very funny. They're going to want to hold on to whichever doctor tells them what they want to hear.
Yes.
So once we have all the doctors on the same page, I think it's next in terms of policy. One thing that we saw with COVID was how easily misinformation is spread. So I think from a policy point of view, and I brought this up recently in a meeting that we had with the Ministry of Health, actually, that we need to put that effort in from the health person's point of view and perspective to inform the public about what is right, what is actually right. So that may mean letting people know what your blood sugar really supposed to be. You know, what is your consumption of carbohydrates supposed to be? We talked about the hidden sugars. I don't know if you've had a chance to have the local cuisine yet.
I've had some of it, you know.
And generally, as Caribbean people, we do tend to eat a lot of carbs because coming from our, you know, even days of slavery, we made up a lot of our meals with a lot of starch because we weren't getting like the choice cuts of meats and whatever. So we do have that tradition. But we have to look at it like, yes, that's our tradition, that's where we come from, but is it really of benefit to us now? Do we really need to hold on to things that we may have learned as slaves that may not be serving us now in this modern day time? So from a policy point of view, I think education is really important. So I'm very happy to be with the Diabetes Association. We go out and we try to educate people. But even from a national point of view, you would really want to see a lot more information just being put out there to the public about healthier living. And then, you know, looking at things like our environment. I don't know if you've noticed that here in the BVI, we will drive to the doorway of the building if we could. We do not walk much. And now we have a trolley that takes us all over town. I'm very, thank you, Minister Kai Reimer, for that. And it gets the people around. However, tomorrow, funny enough, we have an awareness campaign. And we're asking people to wear your blue. Wear your blue again, and we want you to wear your sneakers. Don't take the trolley. We're encouraging people to walk around everywhere that they need to go to. At least, if not the day of the year, tomorrow is going to be Paint the Town Blue. Okay. So you're wearing your blue, you're wearing your sneakers with your cute outfits, and we want people to get out and walk in our Caribbean sunshine.
Yeah, the sunshine might be a bit of a issue, but we'll see how many people we can get on board.
Please. And then, you know, again, from a government point of view, to provide those spaces for people to be able to go walking and exercise safely, you know, playgrounds for our kids, because we do have an issue with our kids not being healthy as well. So from a government and policy point of view, we would like to see all of that addressed.
Okay. And in terms of people, if you could recommend any short-term changes, things they could do immediately to probably steer their life away from developing diabetes, give me like your top three.
Top three. Number one, and again, I'm being very mindful that we have modern day lives, so it's not always easy. Like I have my profession, I have my son, you know, I have, you know, family life at home, doing all this, you know, extra work. So many things that really work for me. Being mindful of what you eat. Because sometimes we really don't think about it and we just kind of think, well, it tastes good, so we're just going to have it. You do have to be a bit more mindful about what kind of effect is it actually going to have once it gets in my body. So being more mindful about what you eat. Two, being more purposeful and being active. A lot of people, we work hard, we're tired at the end of the day, we're frustrated, whatever. It's so easy to go to bed late at night because you were scrolling on Facebook and Instagram, you know, looking at Twitter media, trying to catch up. And I get that, but, you know, being mindful about going to bed on time, you know, and so that you can wake up in the morning and you can actually do a little bit of exercise even before you go into the office. You know, walking the stairs rather than taking the elevator or, you know, escalator, whatever you have at work. Parking further away from your office and actually walking to the place and not driving up to the doorway. Those are some, that's another way. And rest and relaxation, which also includes like trying to do things that are fun. You know, go to the beach. We don't really do that enough anymore. Take the kids out. Relax your mind, because we are under, again, we have been under so much stress over the past couple of years. It's about being very purposeful in creating your own happiness.
Amazing. I feel like that quote can transcend to so many different
Yeah.
areas of life as well.
Yeah.
Well, before we close off, of course, people would probably want to know how they can keep updated with the very busy Diabetes Association. So how do we get in touch with you, and what are you on social media? How can
We
you know,
are
connect?
on social media. We have a Facebook page. It's BVI Diabetes on Facebook. We don't have Instagram and TikTok just yet, but we're
Just
gonna
yet?
work on that.
Okay.
And we do have an office. It's in the Yana Downing building on Main Street. For those who know Lady Sarah's restaurant, it's right next to them, or the Roger Downing Associates. It's an architectural firm. It's near to the hospital. It's just before you get to the hospital, before you get to a Dinah Donovan home, on that last stretch of road before you get to the hospital. Our office is there. There is a sign outside so persons can see where we are. So come and visit us. And I must say at this time, we are going to give a big shout out and thank you to our partners and sponsors, Unite BVI, who actually sponsored us a facelift the other day. So our offices are beautiful. We had an open house last week, and a lot of people came in to see the facilities, and we're very proud to show off our home. So please come and visit us on Main Street. Our office manager / diabetes educator, Rosie Dawson, is there, and she's always there to give information to diabetics, caretakers, families, whoever might need that kind of support. She's there as a shoulder to cry on, which I have done many a time with her. But she's also there to give information about diabetes management. Our number is 494-4125. So persons can call the office, they can make an appointment if they want to come in and see Rosie to get that information. And our email is bvidiabetes@gmail.com. And I'm going to encourage persons who are interested in coming to the symposium next week to please contact us at the office, email, call, whatever it is, register. Because it's free. The symposium
Everyone
is
loves
free.
to hear free. Yes.
There will be food included. And it's going to be a great opportunity to be able to educate people. I'm very excited about this endeavor, and I look forward to as many people that can come as possible.
Amazing stuff. Now, we're all looking forward to seeing that, and we're also looking forward to painting the town blue tomorrow in our sneakers as well. Just a sea of Virgin Islanders out there.
Yes, and what people did last year too is they actually did like little videos at their office, and people showing off their sneakers to show off your Air Forces.
See, sounds
your
like a good
Jordans.
time to launch your TikTok.
It just might be. Maybe. But yeah, definitely, wear your blue, wear your sneakers, show it off, show how we are actually making those changes to have a healthier community.
Amazing. I just want to say thank you again,
You're
Dr. Lewis, for
welcome.
being here. I feel like you will be back again soon.
Yes.
So I'm looking forward to seeing you again, and I'm looking forward to seeing all the blue for the rest of the month.
Yes, no problem. Thank you for having me again. I really appreciate this.